Nunavut miuru blaku tapape ublumi olin lo atau herlo nuban naryo akaptut amihungo tut Nunavut iluani 11 namatakwa tamang melukta arveni sutin Nunavut iluani mana 80 ni nuban naryo akaptut 80 amatakwa katilukta arloge kawe haktau himayut taimang piga kapta nuban naryo ami 4,964 maliktau himayut Maman na motikid lugo 724 huli malik daw nuban naryo kangi mangata amatako Nunavut miud nuban naryo kalautut nuban naryo kakon nertut 113 tako 113 mami himalakut hung nilaktut ublumi hudlak panguk matako Nunavut ilo nakahutak palaoyang na apta ukuratak palaoyang dudu tunamien kay tigwakta katako Nunavut miud tako anya ka nangitukud malakoyang imalitsa daw labut malitsa ko tigutan na nuban naryo angigilang imat amihungulam ngimat tako anya tu tamak teluk tata ko malitsa labut tabo Nunavut makawi himalakap tatako nuban naryo nunaling tikel atwa rangat huyu luang mangan kawiman nangisu ni anya tu mut angidalamek tu ho mata na agwe ukto hauti gilugo takwa amihungo le mela mata amakuwe hukto ngata ko na hauti agwe ni miki gbadda awila mata takwa to hango lang na la alwa to he takwa agwe mi charta lugit katinga loang iluta kanigi loang iluta kanigi unga hiktigi ni ayon na rota takwa kina pai matwat atok ta lugit anya ovit ay himalutit anya luti antengi luti ay himalutit tamap talukta takwa malitsa optigo uwaptini ama ilaptini meneretsa luta ma meneretsa luta takwa ilabut na nuban naryo 19 anging langiman ama ta anging lingi patakwa nuna libur menerene optigo tamap talukta pilaretsa luta malitsa luta ta nuban naryo anging langiman ay himal taluta uwaptini ama ilaptini menere chaluta matnaw yohinu Nunavut. Good morning. Today Nunavut has 11 new cases of COVID-19. All of these are in Arviat. Nunavut has a total of 80 active cases of COVID-19 and the total number of persons followed to date is 4,964. And there are currently 724 persons still being followed within Nunavut. And here's the good news. 113 Nunavut have now recovered from this virus, COVID-19. As we begin our first day of ease restrictions in all communities except Arviat, I want to remind everyone that public health measures are our best defense in keeping our numbers on the right track. Please don't mistake loosening restrictions with not having to do your part or being prepared for COVID-19. Nunavut has seen firsthand how easily the virus is transmitted, so we need to keep working hard and staying due diligence. Wash your hands often, keep strong physical distance, and wear your mask when not possible. Keep gatherings small and stay home if you feel unwell. We are all counting on one another to keep our community safe. Let's all stay well, stay safe, and do our part. Thank you, Nunavut Mute.
Good morning. First, I want to take a moment and address the measures still in effect in Arviat. For the time being, the public health restrictions in the community remain the same as the past 2 weeks in order to stop community transmission. Masks are mandatory in all public spaces. Outdoor gatherings should not be more than 5 people. There should not be any visiting in other people's homes or cabins, and travel out of Arviat is still restricted. I know that this is a difficult time as the strict measures continue, but please understand it is not meant to punish Arviat. This is the best way to break community transmission and the fastest way to eventually loosen these restrictions.
Ulla sakut sivulle paami pivirharninni qausaqakainnarumayunga sulimalittaugialinnik arviani. Maannaukeinaartutraako aaneaharnangittulirinarmuut malittaugiali nunalinni assuqqajaangittu taakkuninga maqquuni pinasaarusiusimayuunni atalaortu. Tamanna nunalinni saarmapallialerunagu. Matuarsimagiarhartu asaaguurbihangittuuni kikkutuinarnu upattauvattuni. Silami katiqattartuut tallimaunga taanuursimagiarhangittut. Pularahattariahangittut asinginnuangiqariaujunut ubbalu illoqalaariaujunut. Ammalu suli aullahattariahangittut kibbiugiaharanilu suli arviat. Tamanna hauimayung ajornartuugaluar tamakku asaaguurbihangittuni malittaugialinni kayussinaartillugit. Kiseani tukisiumaniaqqasi tamanna inerterigiarutaungimmat arviamiuning. Tamanna kaunerpaangumma nunalinni seermapalliatit sittailinermut ammalu sukannerpaakku taakku qasujauvalliagunnarsigayangata malittaugiahartitaujon.
I want to add that after review of the latest public health information and evidence available, masks in both Whale Cove and Rankin Inlet will continue to be mandatory. Moving forward in all communities with active COVID-19, masks will be mandatory. Today, I also want to address questions around the length of isolation in homes where there is household transmission.
Ilasigumamiyunga taakku ahimekkujaulortillugin utaangunnerpaanaaharnangittulirinnermutukisigiarutiatuinnaujut. Matuarsimagiaharningi tamakkiinni tikirarjuami kangersinermilu suli asiaguurbihangilluti atortauqattariali. Sivumugiartilluta nunalilimaani nuvadjuarner 19 linni taakkua matuarsimagiali asiaguurbihangilluti. Ullumi uqausaqqarumamiyunga peqqutiussimayunik hanutigi taakkua anittailititaugiartarmangaa tangiqariojuni taakkua angiqariojuni seermapalliaqatigiittillugi.
The isolation period for people who test positive for COVID-19 is usually 10 days from the moment they receive a positive test or from the moment they develop symptoms, whichever comes first. After these 10 days, more or less, the person is no longer considered infectious and is cleared by public health. High-risk contacts, including people who live in the same house as the positive person, have a high risk of exposure and must isolate immediately after a household member has tested positive in order to prevent community transmission. They also must remain in isolation for 14 days after the last person who tested positive in their household has stopped being infectious. This is because exposure to the virus can happen anytime between the moment a household member tests positive and the following 10 days of isolation period.
Hanutigiani teilimatisaugaaharningi tamakkuan naluneertauvattu nuvadjuarnak 19 hamninginnik ulluni quliugajuttut taima naluneertaulortillugu haujissarutikkut ubbalo hanuigutitaapalliajuminiutillugu nalliatuinassivulliuju malittauluni ullu qulinaalortillugi taanna searmarsigunnernginnerartauppat ammalu nalineertaussimalleqqaannearharnangittulerijikkunnun taakku ulurianartumiinnersai katijaussimayut ilagijaullutik taakkua illumiuqatigi taimaanuvajuarnartutaarsimayumi taakkua searmarpiutuinnareahartillugit anitteilitsautigiligiaraqattartut illumiuqatinganik naluneertaujuqalaortillugu nunalinni searmarpallaalequnagu anitteiligiarmiyut ulluni 14 qaakkanningagu taanna kingullerpaar naluneertaulortillugu angeqqamiuqatingani searmarsigunnaililaortillugu nuvajuarnartaqalaortillugu taimimma katijaujumini taatsumungan nuvajuarnartulimu hangantuinnaqqaakkua searmarpiugunnarngata illumiuqatauju naluneertaulortillugi nuvajuarnartuqarninganut ammalu ulluni qulinik kinguniagut anittaililaortillugu.
It's also important to note that the risk of household transmission can be reduced by maintaining physical distancing as much as possible, regular cleaning of surfaces that are often touched, like doorknobs and countertops, using separate bathrooms if possible, not sharing drinking glasses and utensils, wearing a mask, and washing your hands frequently. Finally, I would like to thank all Nunavut for their continued cooperation. The only way to stop the spread of this virus is by working together. Thank you.
Pimariugi wakaya mayaugi harning ata ko lo kaya nak tumigo te harning ang kami o katigit siya makatigigun nak ninginut siya matayligun nak tut inu katigit hanigilo at tayo lahat tarlutik salong makaya tawin nak luti alla kaya tawin nak luti tamak ko atok taw kayo tut surlo matumi matuyak sigutit tako alo sangu yait amalo tako imikut anak berakat tarluti tayo may gun narutik Tako amek kakatang ilutik imiutini kamalo tamakko ni nga siputi galanik matuwas si makatarlutik amalo aggamin ni kwasay na katarlutik. Kayong pa me ko yan na meron mayak Nunavut miulimay kayot siya kataw yun na mata taman na nukati tayo kung na nga siya mapalya ni nga Nunavut yung nakpiliri katiginik ko. Ko yan na may.
Trevor at Nunavut News. With the curve flattening, what can you point towards that contributed towards that?
Trevor Wright, Nunavut kunita na hatsi na kapalya dita ila hatsi na kapalya lak tilugay kisimita man na pidyo tsaka.
It's two things. It's the majority of Nunavummiut, majority of residents in the communities that are affected doing their part by, for the most part, observing the public health orders. And the other part is the work of the contact tracing teams with the lab work to identify and break chains of transmission.
Makuling aluang waktu tako ami sunak sa ino na vumita ko ilaw kataw ning ino ikayot siya ning ino mali kataw nang motako ning anahar nang itulari nang mamalit taw gaya ako taw yunik amalo tamak ko anahar nang itulari nang mapilari kataw yut amalo kawi sak binyaw ng sibim mi kawi sak tiyo yut tamak ko ikayo katigit tuin na yut siya mapalya ni nukak titaw kulugo.
Are there any lessons to be learned with this most recent outbreak, given that we mostly had no cases since early in the year?
Kasi ni iligot sa kaksima bitamak ko siya mapalyagat katalaw tilugit bigala katak tilugo pitakalaw ng ikalaw tilugo.
Yeah, every time we've responded, whether it's a false positive in Pond Inlet or Hope Bay, we've learned ways to make better use of the rapid response team and to better support that contact tracing work. There's been lots of lessons learned in how we interact with the hamlet and support people in isolation. We'll continue to review everything and accumulate it all, and it's an ongoing iterative process to make each operation or each response better than the last one.
Eko hanga tu nakamayo haptilugo tamako ili palego tigis maya vami sutsulo tamaksuta nalo na sila sa matillo tamit si matalimi amalon uyar na bimi Hope Bay mi tamako ili tigis maya vut hanok taw ta ko to ver nak to kayo reaktibo vat atok taw sa kan na mangata katiyaw yubinang nilo kayo sa hatak na mo tamako ili tigis maya vut tamako lokano piliri hati sa ako na nang miham law unik amaluta ko ngani tayo lititaw yun kan lunani ili palyago tigay naktavot atunit sakri palyayo malit tigit.
Megan Dooling with Nunavut News. Will you please confirm whether or not 2 health staff in Arviat have tested positive and others are in isolation, and that's why the Red Cross is in the community?
Megan Dooling nunat siya kun ninalo na sigun nakimak ko na naham nang itula na may kanayak din ninalo na tao si Mayokanga kudani. To my
knowledge, that's incorrect. There were some health staff who were exposed and were in isolation, but I'm not aware of any health staff testing positive, and I do believe they're all out of isolation now.
Taman na ta suling ito tako kisa ni katisi yumini ugalawat ani tayo tumini kisa ni kaway mangitong atako nalo na tayo lang mga ta kisa ni tako ani tayo kaya kakuner tumahan na kanuingin no.
And the Red Cross staff are there as infection prevention and control experts, so their expertise, the biggest part of their expertise, is in steps around cleaning and doing other precautions in a variety of facilities, workplaces, the Elders Center, to maintain the safety of Nunavummiut who are delivering critical services and maintaining other functions. That's separate from the health center staff.
Tako Red Cross ko tawa ngak tukki kayo kaya si mayu tako lipid jute kaluang ngak tamat suminga no badyo anak mig siang mapalian ng anino katit siga suang na maaulat sinang mulo. Tako hawi mayu tau siya tuti kanu salong maksay gaya ham ng mut ujersut siya gaya ham ng mulo tamak ko apilere hati hak tuti at sige ingit tu ni sulik kanayak biyo yun ni kamaloy inutukak kuwinik at tanak tumili kunagino na vumiyon tako alo mariyo yun ni pijit sa rauti kayo sit siya kung nakulugi pilire ang uyod.
Justin Trudeau announced that they'll be helping to bring rapid testing to the isolation hubs in Winnipeg. How are you working with the federal government and what do you know about that to make that happen?
Justin Trudeau hanang ay kayong nanarasunita ko akila miyuyuk ko kaway sa rutinik Winnipeg mo tuyong mi vinut anit tayo livyo yun notit silo ni kanong gavamatok ko.
Thanks. We're still working out all of the details on this. We don't know the date when it'll start, but we're going to be using the PanBio antigen testing device that can be done in settings like hotels, and we'll get results very quickly from the time that the swab is first collected.
Hoy na mi suli tamak ko ilulingin ni kaya nginata hangak kululungan ni nalo na tawla mga ta kasi anita ko ay mi suno kaya sa rutinik hilamik ko utirun naktunit ato katarna to go to yung mi bimmi kaya sa rutino ato katarlo titan kunang to yung mi bimmi to ni.
And the testing will be initially offered to everybody, whether they have symptoms or not, when they enter, partway through, and after, or towards the end of isolation, so that we can use it as a way to augment the current isolation practice and reduce the chance of COVID getting through the isolation hubs.
Tamak ko kaya sakta katala to kikulimat kanoy guti kang ito ko lo kaya sakta yun na katala to tako na nito yung mi vimitut so lo isulir guti palalak tilugi tao na ngayon anit tayo liga kang ning itaman nakakan ning agut kaya sa kuti atok tao na akto tao na nito yung mi vinitaman na no badyo na no nabumo tikikan nili kunago.
Thank you.
I'm a transfer to the Canadian Press. Our lockdown is lifting in most of our communities today. At what point would we go back into lockdown? I guess I'm wondering, is this a continuing strategy we'll see if another outbreak occurs?
I'm a transfer Canadian Press kunni taman na matumayaw ni vo taman na kuya na tao na alak tilugami suina sa nino alin ni kanu matuyaw kan ni kayak kanu lo hanok to ko tikas mabataman na matuyaw kan ni kayak kanu ilak to kak tilugo.
Not necessarily. If we see COVID-19 in one other community, we could respond to that, deal with it as we did in the 4 communities so far, and not necessarily use up all or exceed our current capacity. I'll let Uli interpret that.
Gawgon nakto kasi anino badyo anak 19 hato kalam na kasik kaningan nino nalin ni tayo maka magigayang medya butay matsay na ulumi mo si tamanino nalin ni ka magisimagattigo mana yoklo sulo hangi utine ako nagita makkuapili riyibon.
The concern a little over 2 weeks ago was that we were close to the limit for our capacity to respond with the rapid response teams. The response would have been slower and not as aggressive or vigorous, or might not have been, especially if it happened in a larger community. And so to avoid that getting overwhelmed and letting things get ahead of us, we opted for the territorial-wide lockdown. We're in a better position now, and so we would have capacity for some communities, but it's going to depend on a lot of circumstances. So that's why I can't say for sure it's going to happen one way or another. But yes, it's going to be a possibility that we could have to do this again.
Isamalo na lang nga pinasako si nasimalakto tamakwa piyun na tivo piliri tamakwa amigarsi kasalilaw nga ta takwalo to avam nakto kikayo ati watto hilami yuk kamagun na runne kayalaw nga ta tay ma amigarsi luale rutta pilo akto minu na linyang inaksani sa magbiyo yung halaw nakan tay may man nirwali law kuguno na vuli maami mato yaw kuyillo ta kaunaw naksami kulluta kisani taana tunga verhamne to amisuni khani sakhi palle ayuni kisani matukkan ni onna tuin na kaya hakte gutay manal na taw yo hakka singin.
The Northwest Territories announced earlier this week that they're testing all essential workers who arrive in the territory. Is that something you've considered or a possibility for us?
Nunat sa amigo nalo na sinang atatakwa tikip palle ayuli makaw isaktaw hattang ni aming ini kanayak tikit to pimario ni pilireli taman na sumasaksi ko tigis mabiyo tamani.
The situation is very different, so not at this point, and as a result, we still have the significant restrictions that are in place for exempted workers.
Taman na diyong ito may gutakalarik ka taman na tayo sumasaksi ko takangit to taman na ay sulat tikbahaktit sa katamalit tao galin na tamak kuno nga kanayak tinot tikit siya tigihatak titaw yun.
The difficulty we have is that entry testing, like testing on the day or the day before you travel, and relying on that sample or relying on those results is potentially harmful because it will catch some infections, but there will be a number of people who have false negatives. And we've already seen exempted workers say, well, I had a negative test, so I don't actually have to isolate. It hasn't happened in Nunavut, but in other jurisdictions when people have put too much faith in a negative result, it has contributed to significant outbreaks. So we're sticking with that approach for now.
Ajing ila yung nakutik hang tamak ko tikip palle yo kaya saktaw yo ilaw hatta tilugi ulungani ubalo tungani tikila tilugi tako tatilgilo ako nangikut tatigilo ako tigulo kaya naktumiti kaya kata ilang kaya kata ko naktakalo abo tamak ko kana yakti ang yaktaw si mayo kaya saktaw hatta kata nunavo mi kaya ilaw Iqaluit ako kisani tema kaya naktukak si mayo tamak ko tatigilo lo tilugi siya mapalle ala ko taw ko nang kata ilang kaya sa uti tamasungungin not kisani taman na sumasaksi ko tigis si mayabo.
Jackie McKay, CBC News. Can you say how many active cases of COVID are in Rankin Inlet and Whale Cove right now?
Rankin and Whale Cove. Jackie McKay, CBC. Kung nakakong nakikat siya mga tanalo na tao si mayon kanyang sinang may tikirak jo amilo.
There's 7 in Whale Cove and 8 in Rankin.
7 tikirak jo ami, 8 kanyang sinang may.
We're hearing from people in both those communities that they're worried about going back to work or sending their kids back to school. Can you say why it's safe for them to do so?
Takwa ko to sa katak si mamata isamalo ningin ni tamak ko kanayak bemoy na bimulo matuyataw kanang ningin ni isamalo mata ukaw ila nalo na bigyan ako nakigi.
In both Rankin Inlet and Whale Cove, there's been no concerns or even questions about community transmission for more than a week now. All of the transmission has happened inside households that have been identified as having had contact.
Tamakini kaya sinang may tikirak jo ami nalo na ito yung hasimangin matamak ko ano nalinis ang mapalala mga tapinaso ako siyo nga tani kasi ani taman nakawin ako sumamang kami yung katigini sa mapalala si maningin no.
So for the people who are in those households and are still in isolation, they won't be going to school or to work. And so the risk of exposure with the current, with the measures that are laid out for today is small. And the harms of keeping kids out of school is greater than the risk of further COVID transmission. If that changes, then obviously we'll reassess at a moment's notice.
Tako ilo may hatigi sulu nalo na tao si mabiyo yo hakano ba jo anak to hakningan ani daily titaw yo tamak ko suli ilinia gajangitut amalo kanaya gajangitut taman nalo sa magunarninga ismalunnak tumilo ang maullo miyok ismagillugu tan naleuloganak tuminak saugayanga tamakko asukusi ilinia bimminga ngiti tauluti kisani khilamik ko kayo sa chauti gayak tabo ismalunnak to kalituakan.
And last, there's still a lot of personal responsibility on things like maintaining distancing, keeping social bubbles small, washing your hands frequently, and wearing masks. If after all that, there's people who individually feel that this is not appropriate for their personal risk level, then by all means, they should meet with their healthcare provider and consider, or their supervisor, and consider other options like working from home or flex work hours, those kinds of things.
Kingulak pamit ako sulu inulima namin sulu piliriat sa haktit piliriat sa hangata sulu tamakko ino katigina kanit saluat tayo ng mot agkami niwasay na hatan ng mot ino katimin nilo katikatak tamin ni katsin nautit silutik matuak simay na hatan ng mulo tako hakan ni nga gutay maak akaw kayang imat uluganak tumitit silirang namin muta namat sang ipatatak ko kanaya ilang yok kami ni katikarunak to akit siluti kakayumayang minni ko balok kanaya ngit sa makigom nak mga atay ang yok kami ni kaya bikarunak to at ni taluti.
Ken Driscoll, APTN National News. Dr. Patterson, if people are planning to travel south during the holidays and then return back to Nunavut, they probably need to have booked a stay at the quarantine hotel by now or have been in touch with your office. Can you tell from those bookings and the statistics how big a travel rush you're expecting as we get closer to Christmas?
Ken Driscoll, APTN ko niluta Patterson amis sukallo na ano awla kumanyaktut sa matano na vumengaktut init sa liok sa malutsaw lang matalo tako na nito yung mivindi katsi yung mga tao kakon nakita ko amis yung mga tao ko viaso bimiawla ka swala to yun.
Yeah, the numbers, the last time I checked, the numbers were rising for people traveling at Christmas time and increasing numbers of people in the hub in first part of January, late part of December, presumably people trying to get home after the holidays. I don't think they're at capacity or overbooked at this point, but it's a concern, and we'd strongly encourage people to not go on non-essential travel because I can't comment right now on what the risk is going to be like in the south.
Tako katsi mga tatakulaw takalaw kakisan ami songo palias mayo aw lakas wakto ko biya subi ulungin ni tako ilagay yaw luti ami songo palias ila ami sulat to utirbit sa January bigya kata tilugo malo December nung wanit taman nakikang na anigo palalak tilugo tako tatalangit to galaw balo init sa hakto galaw sulikisiani sangi yo mi ho jiga ko nga pimmariyo yuni pidyo te karlo te awla katta ko yiga tatamak ko uluga nak tumini hanu tigi nalunang nga kanlunana ko sa matilugi.
Minister Kusugak, please. Minister Kusugak, yesterday the government of the Northwest Territories announced that they're going to no longer cover quarantine costs for non-essential travelers. That idea was brought up here and dismissed pretty quickly a few months ago. I'm wondering, in light of that NWT decision, is that something your department is considering?
Minister Kusugak no na siya gava makungiligo tako nalo na sang ngata akil ko katta jagon ne ngata inutubiyo yun ito yung may mitik si katta ng mut tan isumagayaw si mga ilit sino kano nalo na yung nakyo.
Kaya na may tayo man na apikay gawin. Taman na okaw sa kay katak si mayabot. Tagpanitak kanya ato na oktap tinikisiya ni man na mo tikitlugo. Tam na ato diyang itabot. Kau isang nayak tabot, udyok tong nayak tabot. Lakan may daw palian na kayong itap ko NWT mo tayo kisiya ni man na isa makangit yung tayo man na liyo reksak. It's something that has been discussed and it's something we will be watching our northern neighbors go through. But at this time, our government is not looking at doing something like that or similar to that.
Trevor Wright, Nunavut News. Questions are probably for Dr. Patterson. With rapid testing coming to the hubs, presumably down south, are there any concerns about false positives coming out of those tests? Or
Trevor Wright, Nunavut News, kunni tako akila miuyuk ko kaya sa uti atukto katalati lugi halunani isumalong nakata ko tamma katalang.
Some concern. The rapid test that we're using, the PanBio, is known more for false negatives than false positives, but it's still a possibility. So anytime there's a significant concern, either a positive result or somebody who is higher risk but gets a negative test, the option will be to do the PCR test and have it reassessed in a lab in Winnipeg.
Ilang ago sumalong naktugal atako kaya sa uti akila miuyuk ko naktu PanBio ngun raktayo tamma kayut tu nuwadyo na hangin ni kailutik tako alo tamma nginnersaw hattaktu nalunayartayo hartillugu kisani sumalon nang atako kaya naktu mainnersait kaya sa uti kayaktu PCR ngun raktayo ko tako alo nalunayartayo kan hattakayaksut kaya sa Yumi Winnipeg mi.
when would monitoring end in Savikataaq?
Tako kaya saktaw valianing isani kilo ang mikangay sulilakan.
There's still a few people in isolation. After they finish their period of isolation, then there will be at least 14 more days or 2 more weeks of close monitoring. And then at that point, we'll have been 4 weeks from the last time somebody was infectious. And that's the point we can say that the outbreak in Savikataaq is over.
Tako suli hatsi na ulit tugalo ani taili titaw yo tako pijarir sa malakatani taili titaw ningin uluni 14 mapuni pinasako sinik tako kaya saktaw gumni kayak to sita mapingasu sita mat pinasako sit kingulak pa minalo na taw si mayo pijarir sa malakatana siya mapalian nga sani kilo ami pijarir na taw kayak to.
Megan Duling, Nunavut News. Can teachers in Arviat go to their classrooms to prepare lessons and communicate with families at this time?
Megan Duling Nunavut kun ni tako ilid na titsiyak vian ilid na bingin no naka kitsuiluting ilid na utigun naktuni ukakatikakon nalutillo ilid na timini.
I don't have a problem with that because they'd be going into their schools by themselves, working in the classroom, not in groups. But it's also, some of that's up to the Department of Education and the local district education authority. They have a role or they have responsibility in that decision as well.
Ana akang mili ko tikangit sa ta kaniging itata ko ilinarbe mo hatakayang atay no tulutik asi kangil lutik ta ko alo ilay sa mali ko tagun nakto taman na ilinar niliriyik kun ni amalo nunalin ilinar to liriyik ko katimaying ita ko is mali ko tagun nakto tamatumunga.
I have a question for the Premier, please. The latest federal funding that was announced for Nunavut, the 11.36 million, 1.3 million was to expand internet bandwidth. And I'm wondering exactly who the service provider will be, how that will look like, what devices will go into people's homes so their bandwidth is expanded. Can you talk about how that will actually work for people here?
Tana nutang nakpagawa matokak ko kaus rilaw tanga kinaw ya haptit sinangmot 11.36 million ilangan itako 1.3 million tuangan nakaktaw lang atay kaya kivihaktit sinangmot kiko pichirat tiula kata ko nung malukis unik harisaw yak ko rutini atoy naktakala kanon alin atoy nakakan niron nakulog kaya kivit ko now tini.
Thank you. My understanding is a good portion of that will go towards education to get more bandwidth for the schools. but I'm not familiar with all the details right now, so that's about the most I can say. Kawi maya kutana idang anginak pa nga atok taw na ilin na wing ila takwa ilin na to tinut takwa ilu da kalu tang man na kawi maning inaki.
Thank you.
I'm going to try to enter the Canadian Press. This might be one for you too. I guess I'm wondering, travel through Yellowknife is obviously suspended with the bubble suspended. Has there been any thought to rerouting flights that go to the Kitikmeot so those communities are able to still travel?
I'm trying to Canadian Press kunnik. Takwa labit sa gunni nga Yellowknife ko tigod no kakti taw si mamat isumagayaw yo hak si maba takwa ko tinga si jakta gun na hulugi kitir miud asya gunga ko sa gun nak gayak mangata.
Thank you. I know the Economic Development and Transportation was in discussions with Canadian North, because that's the airline that flies that route. But today, we have not had any indication that they will be doing that. I know there's provisions in there where if they're passing through Yellowknife for non-extended period, like overnight, I think at maximum is 4 days, that as long as they stay in their hotel, then they still can travel through Yellowknife without having to isolate. Kawi magamata ko piba liri ko kakati lao mata Canadian North mi kihani mana mut tikid lugo ta ko kaluktu chame kangasina mut outlaat ila ihumangita outdown na mata Yellowknife ko taw na mata huli kihani kawi mayako mata ko ublut hitaman mikani pat kacang miu tamang kiwalam o kikatalong mga ubolo ba igluano kacang miu nung mungoy kikatalong mga kiwalam ublo hitamat mikani pat hinikta yani aningina pat tay kanina ilu aningin na lotipit pata tako ublo 14 nito bing Yellowknife mo tay kuna kakayang ito.
The testing, the rapid testing at the Winnipeg hub, was that a request from the GN? How did that work out?
Takwa kila may uyuk ko hayo sakta hatta ka hamning government ko nutut siya kauti usima babalo kano taman na sakta sumaba.
The Department of Health has been working with Health Canada to get any kind of rapid testing devices, and I've also been speaking with the Prime Minister saying that this is one way we would help, because the 14 days isolation, I mean the cases that came in Nunavut, they did do the 14 days isolation, and if they had rapid testing it may have been caught, so it's something that we have been in discussions with.
Thank you.
Just a correction here, I had whispered in my ear. If it's more than 12 hours passing through Yellowknife, then you have to stay in the isolation hub to do the 14 days. We can get more clarification, but that's just what I was just informed just right now. Akigalo utan what chokala moblu hitamat mikani pa Yellowknife ko to 14 days tay kani initu hung mi akang na mata o kau jo haktung atana ikaga 12 mikaniun na pat tay kani anigumak tulut ikaga 12 ungatani na pat tay kani ublu 14 ang initu hung mi akang niya.
Jackie McKay, CBC News. My questions are for Dr. Patterson. Can you explain more about the plan for testing in the Winnipeg isolation hubs, and if it is a pilot project for the other isolation hubs?
Jaka maki-CBC ko nalunaya ko na kayo pang nauti usima yung Winnipeg may tuyong may view yun kaway sa katamner na kila may uyuk ko. Dahil na uto kauti uva ayong nakayang yung mga asingin na tuyong may view yun.
We're still working out all of the details. It's going almost certainly going to start strictly in Winnipeg, in both of the hubs in Winnipeg when it first rolls out. And That's intentional because we were concentrating our efforts on Winnipeg because it's got the highest, currently has the highest risk of introducing COVID-19 to Nunavut.
Sulita ko ilulingin alo na yak palya ya vukisa ni tana pijuti khalo to nga Winnipeg mi tamakke ni to yung mi vinni khawi sakta khatalatu pijuti khalo to tamakko Winnipeg mi amisu ila khutti nak pango maulo kaya nak tumigo taw gun nak ninga taman na sakta gun nak ninga no wadjo am nak no nak mo.
There is work happening to get testing into the hubs in Ottawa and Edmonton. But that work's not moving as fast, or we're not putting as much effort into that work right now because the risk is so much lower.
Pilaya ngo valya mi jugalo khawi sakta khatayang mga ta Arwa milo Edmonton milo to yung mi vimani teli kay nakakakto ta ko khila mi nginak sa makisani ta no Winnipeg mi sipulyo tinak pari gattigo uloka nak tumingin nak sa matalite kunani asingin ni no nalakni.
Was this prompted by the federal money for the economic update?
Ako pigi ako taon nak government o hakko nalo na ilok tangan ni kinaw yala rin ako.
Not entirely. It was something that we'd been looking at for a while now in a variety of forms, and it was more. It came to a head again when the outbreak started. The first question was obviously, like everybody else, was what can we do to prevent this from happening, and testing is a possible way of reducing the risk, although you will never be able to get it to zero.
Agawalo atang aktigong ito kasi nita ko khimikuwala si majavut sibong agu Allah taman napigel la tawle la to ser mapalla yo khalaqtil logo tako piliri khataw yulimat isamalilaw nga takawi sa khatang nita na inutulo ni tikiteli titagun titsigon nang ito galwa kasi ilagi yaw gun nang tamat suminga no wadyo na may tikiteli titsinamo.
For Whale Cove and Rankin Inlet, are students going to be required to wear masks in classrooms?
Tikiradyo mi kang sinang biluilid ni akti tamakko matuwak sa makatakayaham na kailid na kayaktil lawit.
Not right now. The evidence is that if you can do those other things that the schools will be doing, maintaining cohorting, keeping children in specified seats, that sort of stuff, that masks may not have any extra benefit to that. However, if a teacher or student or anybody in the schools wants to wear a mask, they can. There should be no reason for them to feel ashamed or anything like that. And if in the meantime evidence changes so that masks in schools have seem more appropriate, then we'll change our plans at that time.
Mana yo aga matuwak si malaki gatong ito ay ma kawi si magatatamag ko asingin ni maligayalingin ni malikatang na ang ata ino katigini kanilo at tayo tit sinang mutako aloit si vautang yung sige jo mi kulugit tako matuwad ato takalaki gayang imata kisya ni ilin ni atit si jeme ilin ni ati milo ni ato kumayo kakamatuan ni tako kano ingit siyang mayo tako alo kang Kusugak ang ito ato kaya mik kisya ni tamakko sakip pala yo asid sakata matuwak si magyakam ng may asid si gayak tigo atok tao gaya kakuyilota.
Kent Driscoll, EPTN National News. Dr. Patterson, part of the planning for the eventual arrival of COVID here in the territory was designating places within communities where people could isolate if they couldn't isolate at home. So far in Arviat, it doesn't seem that your department is using any of those self-isolation spots, and people in Arviat are asking why.
Hentrys ko EPTN ko niluta Patterson pamnaw takalaw sumagat si taman na Nunavut 19 tikit talir na kano Nunavut tamak ko inutuviw gayak tunig ilo ni lalo na si sumayuminiugat si Arviat niluta ko atuk tawlong imata sulisan nagbaktaw si mayugalwat inutuviw kay nakayak to naktut tako Arviat mi apeksulang ngata summat tako atuk taw jangila sa nagbaktaw si mayo.
There has been an inventory of sites or rooms, apartments that are available for use, and it's nowhere near what's what could be needed or useful to have a meaningful impact on the outbreak. And so what's been happening is the outbreak team, mostly a number of nurses or other staff involved in the contact tracing, and the lead outbreak physicians have been reviewing cases and figuring out if moving somebody would do more harm than good.
Naluna yaisima yugu tamakuni ngatu inno yuni illo serne kubalo apartments nguni qarta yuni katu inno luti atokta uga jarlutik kisani taako atu tikhare atulausmangitu tamakko sermartulernermo pilleri khatigitut tamakko anna surti katiyo yuminerne khawi saqpalle yo tammalu taana sivulekti yo luta tamanna serma palle yumi khawi saqattangata tamakko nuttersi patatu tikhare mga balaka ngili roteule kaya mga lumimot tema nuttertaw yo khare khalangitu tamakko nga sanak baktaw simayon.
And it's important to note that by the time symptoms are identified, and even with the charters, and this is true all around the world, by the time people are identified as an active case, at least half of the transmission events have already occurred. And so if you have a house of 10 people, there's no way to know which ones have it, which ones don't. And so it becomes, a lot of times it would simply do no good and possibly be harmful.
Pimari uvo tamakko khani guti khappalle alaqtillugit ubballu tamakko hangata titayu surlu khawi sarutini aulaqtit silaqtillugit taakko nal surlu abballu angi sarmaq biusimaleriqun nangata surlu khuliunne qata illumi khatigit khawi manangi nalla sarmaq biusimamangata kisani tamanna tuta khayangimma akawngiliruti ngali kayanga tamakko no taupata taima khawi matinnata nalla sarmaq biusimannangmangata.
The other bit of good news is that once COVID gets into a house, even in a crowded house, although it's a concern, and I'm not in any way trying to minimize the housing crunch or crisis, it's not a guarantee that everybody in the house is going to get it. We've seen in some houses where when people are careful and there is some luck in it, but it also requires them to put a lot of effort into it, that it's not a guarantee that everybody in the house is going to get it. We can stop transmission within the house without resorting to relocations or those kinds of things. I don't want people to despair or give up.
I'm slow today.
That's okay.
Takko ilangi tusaruminaktu medyo tamakko illu meu khatigit amisugal waqtillugit tamanna illu khat sianginnert imamikillivaallерти gasuangitara kisani naluna qaismagunna jangin matakko ilunnatik illu meu khatigit sermarbiunerninginnik ujersut siatuaqata takko alu atsuruute khatuaqata malittaugialinnik nuttiqtaugiatungillutik takko sapilirtailerut siartavut ammalu isamakhat siaqasuanginnarullugi.
Dr. Patterson, we're all seeing a lot of handmade masks here in Iqaluit throughout the territory. People are sewing in order to make non-medical masks. I'm wondering if you could give some general advice for the people making those masks. How many layers should they have? What about fit? Is there anything that you can share that will help people make masks at home?
Luta Patterson takuvalleagatta missuni taakko mersuqattaqtuni matuanik Nunavut miorasaalu mersuqattalengata tamakko luutaanu atoqtaugaatungittunik qanu qautigaarunnaqhigit qanu naammagiaqammangata qanarluunni tamakko nalunairearunnaqhigi.
It has to be comfortable and relatively snug so it's not moving around. If it's loose or flopping or uncomfortable, then we're more likely to be reaching up and scratching or adjusting it all the time, and that's going to increase the risk of contamination.
Akaunatuaqata malunaamatsaatuaqata ima qasungangilluti attuinnaqajaqattigu akaugingikkuttigu qasungatillugi taima naamatsiatuaqata qanuigingitavu taakko matualiuqtauqattartut.
3 layers are better than 2 layers, and 1 layer is better than nothing. So 3 is ideal, but if all somebody has is a 2-layer mask, go ahead and use it.
Tako pingasuling ako yaw katatuan no katsayay akaw naksamak gunik ataw sarlunay na matuas si hangi patakisya ni tako pingasuling ayo ne kausiw kayo to tay matuas meksuk taw katakulugit.
And the other important thing is to consider how we use it, how we wear it. It should go over your mouth and your nose. And if you're taking it off to get a drink of water, don't just pull it down over your chin. Either take it off completely or take it off 1 ear.
Tana taw pimariw miyo kanok tako atok taw katamningit mamatuak si matsarali kanak pit hingak pillo kangagok si matsarlo ni pirneak logulo tana taw nungat apak tito inakatang ilugo ilo nga pizza marilugo balo siutipia ay patuangan inibingat ilugo tayo makanoing ito.
We should wash or sanitize our hands every time after we've been handling the mask, and the masks should be, the reusable mask should be washed at the end of every day.
Agkatilawa sa tsaw katalogitan na matuan kamagilaw lugo malutan na tuk tamini ulo tamawa sa katarlugo tako igigaw ngito.
We have time for 1 question, and then Premier wants to make a quick clarification.
Megan Dooling, Nunatsiaq News. What message do you have for people in Arviat who are worried the infection won't be gone anytime soon?
Megan Dooling no natsakon ni kanokaw tigong nakikita ko ak via mute isamalo ko nagita na nubadyo na video tigilugo.
It is a long haul, but if we stay the course, it will go away. We can already see right now the people who've recovered, the number of people who've recovered is greater than the people with active COVID-19. So because of the work that they've done for the last 3 weeks and the inconveniences that they've put up with, they've made great progress, and will, if they continue to do that, they will continue to make progress.
Taman na ako ni unatok taman na nungupalya titaw ni nga kisa ni tako ito sa kuminang nga tako ami sunak sa matakanoy kun ni palya sa mayo nalo na taw si mayo ni ami sunak sa ulak sutik tako at suru takak si mamata pingasuni pinasaro sernik akakayang itukur si maluti kisa ni si bumugi ako tikak palya si mayo pipalya ko tikak siya to tayo makayo sit siya to na kuya
Tana pidyo da kako teng da nunatsia mi te kwa nunatsia ko rea kako nunavu mo au lakut. Tana ikpa ka adlung wala wa tana ku hiumet siang ilako. Nalunang onliang nama ta kwa yellowknife ko au la rea kako ikar twa mikani pat hinik tawing mo rea kako ki hani hinik tawing mo mengungi to te ko initu hibi hinik tawiano te initu hibi hinik tawi te kani luti ki hani ta kwa yellowknife could Just for certainty here, this is to do with the NWT, traveling through the NWT. As it just changed yesterday, I didn't have all the facts clear. If you're traveling through Yellowknife, passing through Yellowknife, going to Nunavut, and you have to overnight, it has to be 12 hours for less, and it's not in your hotel. You have to stay in their isolation hotel, just to be clear. You have to stay in their isolation hotel in order so that you don't have to do the 14 days. And just another clarification on the, not a clarification, but to add to Minister Kusugak's, both the NWT's decision there to charge for the hubs. We just got $30 million to help us for the hubs, so I appreciate from the federal government, and that's to make sure that we can keep them maintained and not have to charge Nunavut Mute because we just got funding for them. And we also don't want to make it have a two-tier standards where someone can afford to do the isolation and others can't, which would restrict it. We still don't recommend any unnecessary travel to the south, so we still recommend you not travel, but if you must, we will pay for your isolation. Matana tau wachal Minister Kusugak ukalaw mata ko nunatsa milakiditi talnera matate ko initu hibingmit ukalaw maakiditi talang inaptatao ite aito Kina talna the government to kakuni 30 million mintana taking a toral marsoni pingmat takwa kilit lang ita bununu mu taken igahatu matakwa tautuklu takwa akilini ayung ito kihimi aula lagayang mata qabluna nunanu takwa kina kaluang ito ayoloti kihani to kihumat chalna mata nunuvu mu aula ko ying kalwatu qabluna nunanu aula kangil covid outlang ilaw man na yumi tana nuban na ya kabduna na ni man na houting ami hutse mengu malang mata nunabu mi mat na pahi